Hello everyone. The topic of today's discussion is permanent mandibular first premolar. So today we'll be discussing the anatomy of permanent mandibular first premolar. Also we'll be seeing some differentiating features of mandibular first premolar from mandibular second molar. Also there will be a comparison in the end to compare maxillary and mandibular premolars. So when we talk generally about premolars, they are also known as transitional teeth because they are located between canine and molar. This has already been discussed when we discussed maxillary premolars. So by definition, premolars are permanent teeth. They are found in the oral cavity distal to the canines and they are successor to deciduous molars. So when we ask, are they successors? Yes, they are successors, but they do not have any primary counterpart because we do not have premolars in our primary dentition. But since they replaces deciduous molars, that is why they are known as successors. So there are two premolars in each quadrant. That is the first and the second premolar. There are four premolars in each arch, and in total we have 8 premolars. They are also known as bicuspids because usually they have two cusps. One large buccal cusp, another small lingual cusp, which is a cingulum in cases of anterior teeth. Here it is well developed into a cusp. However, sometimes lower second premolar may show two lingual cusps, that is a three cusp variety of premolars. So the premolars are 4 in number, 2 in each side, and they are present distal to the lower canines and they are found mesial to the molars. They are the fourth tooth from the midline. So in the nomenclature, they can be denoted with the help of these notation system. In the universal notation system, they are denoted as 21 and 28. In the Zygmundi-Palmer, right side 4, left side of 4. In the FDA system, it is denoted as 3, 4 and 4, 4. When we talk about the chronology and the dimensions, we have to learn the chronology and the dimensions in comparison to the other premolar, that is from the maxillary premolars and from the mandibular second premolar. So when we compare the dimensions, more or less they are same, but the major difference is in the buccolingual dimension, that they are wider in cases of second premolars. Otherwise, the dimensions are more or less same for mandibular first and mandibular second premolar. When we talk about their relation, the lower first premolar makes contact mesially with the distal surface of canine and distally with the mesial surface of premolars. Always a tooth contacts mesially with the distal surface of the anterior tooth and with the mesial surface of the posterior tooth. When we talk about the number of surfaces, it has 4 surfaces and one occlusal aspect. These surfaces are buccal, lingual, mesial and distal. In cases of anteriors, this buccal was replaced by the labial surface, and in the maxillary teeth, the lingual was the palatal side. When we talk about the number of roots, it has 1 root. So starting with the buccal aspect, please keep in mind whenever you are attempting any aspect, you are supposed to follow the guidelines. Like first you have to tell what is the geometrical outline. So when we see mandibular first premolar, the geometrical outline is roughly trapezoidal in shape. The shorter side is towards the cervical line and the longer side occlusally. That means the crown is converging occlusally. So when we see the outline from the mesial and the distal surfaces, mesial outline is concave till the contact point and distal outline is also slightly concave till the distal contact points. When we compare the slopes, mesial slope is shorter than the distal slope. All these markings you can appreciate in the schematic presentations with the help of the colored markings. When you see the buccal cusp tip, it is mesial to the midline. When you see the surface anatomy from the buccal surface, there are two elevations. One is the cervical ridge, second is the buccal ridge. You can appreciate the purple color marking for the cervical ridge and the blue marking for the buccal ridge, that is the buccal ridge prominence. And because of this buccal ridge prominence, there are two developmental grooves which are present mesially and distal to the buccal ridge. These are mesial and distal developmental depressions. Also, the root is conical with a slight distal inclination in the apical third. And when we compare the length of the root, it is shorter to that of canines. But when you see premolar from the buccal aspect, it looks very much similar to that of canine. Now coming on to the lingual anatomy, the lingual aspect is very much similar to buccal aspect but slightly in a reverse manner, and there is lingual convergence. So the lingual cusp in the mandibular first premolar is slightly less developed. It is the 2/3 of the height of the buccal cusp, or we can also say that the lingual cusp is so small that we can tell it as a well developed cingulum. As we see in anterior teeth there is cingulum, so that cingulum is well developed in cases of mandibular first premolar, which is considered to be a lingual cusp, but it is shorter. When we see the mesial and the distal triangular fosses, they can be appreciated, and the lingual surface is spheroidal in shape. Okay. Also, the cervical line is there, which can be either convex or it can be straight. There is a characteristic feature which is seen in the mandibular first premolar is the presence of a developmental groove mesiolingually. So there is a mesiolingual developmental groove which can be appreciated from the lingual anatomy of mandibular first premolars. Now coming on to the proximal aspects, when we see the tooth from the mesial view, it is rhomboidal in shape, and this rhomboidal shape is because of the lingual inclination. As we have already discussed that the mandibular teeth shows a lingual inclination. So when we see the outline, buccally it is convex from the cervical line till the tip of the cusp, and the maximum convexity is in the cervical third. That is the cervical ridge prominence. When we see the lingual outline, again it is convex, but the convexity is seen in the middle third. Also, we can appreciate mesiolingual developmental groove from the mesial view. When we see the anatomical landmarks from the mesial aspect, the lingual cusp is 2/3 the height of the buccal cusp. The buccal cusp, we can appreciate it is in line with the root apex, whereas the lingual cusp tip is in line with the lingual border. So can you appreciate the markings? The pink lining is for the lingual cusp tip, which is in line with the lingual border of the root, whereas the buccal cusp tip is marked with a blue line, which is in line with the root apex. When you see the mesial marginal ridge, it is sloping lingually, and the contact area is in line with the buccal cusp tip. When you see the root from the mesial view, there is a deep developmental groove which can be appreciated in the mandibular first premolar. When we see the crown and the root from the distal view, it is very much similar to mesial aspect, but there are certain distinguishing features. The first thing is distal marginal ridge is straight. However, the mesial marginal ridge was showing some inclination, and it is perpendicular to the long axis. There is no developmental groove which was seen in cases of the mesial side. The contact area is broader and it is placed more cervically, and the distal cervical line is less curved in cases of first premolar. Now coming on to the occlusal surface, it is diamond or round shape. The occlusal surface tapers lingually. When you see the buccal cusp, it has a large triangular ridge in comparison to the lingual cusp, which has a small triangular ridge. These two triangular ridges, they connect each other and forms a transverse ridge. This can be presented in this schematic diagram with the help of the colored markings. Can you appreciate the blue color of the buccal cusp followed by the pink color of the lingual cusp, and their ridges are united to form a transverse ridge which is marked by yellow color. Also, there is presence of fossae, that is the mesial and the distal triangular fossae, and there is a central developmental groove which may cross the transverse ridge. So the anatomy of the occlusal aspect is diamond or round shape. Now there are certain traits, this has been taken from your textbook Wolfels, to distinguish maxillary from mandibular premolars. When you see the maxillary premolars, the buccal ridge is prominent, whereas in mandibular premolar it is less pronounced. When you see there is no distal tilt in the roots in the maxillary premolars. However, in mandibular premolars there is a distal tilt. When we see the difference in the height of the buccal and the lingual cusp, there is very less difference, whereas in cases of mandibular premolars there is a huge difference, especially in of mandibular first premolar, as we have seen that the lingual cusp was a very small cusp resembling to that of cingulum. When we see the proximal outlines, the occlusal outline is aligned over root, whereas the mandibular premolars show a lingual inclination. When we see from the occlusal aspect, the maxillary premolars are oval or rectangular in shape, whereas the mandibular premolars are square to round. When we see the maxillary premolars, they are faciolingually wider, whereas mandibular premolars are less faciolingually wider. Also, we can distinguish mandibular first premolar from second premolar. We can identify them with the help of these diagram. The second diagram is of mandibular right first premolar. So you have to see the feature. When you see the second diagram, the crown is longer. The crown is tapering more towards the cervix. The cuspal tip is more pointed. The buccal ridge is pronounced and the root is pointed. Whereas when you see the first diagram, that is mandibular right second premolar, the crown is less wider, shorter, and it is wide at the cervix in comparison to the first premolar. The cusp tip is less pointed. The root is long with a blunt apex. Also, the buccal ridge is less prominent. So these are the distinguishing feature of first and second premolar from the buccal view. Also, we can distinguish them from the lingual views. In mandibular first premolar, only one lingual cusp is there, whereas in cases of mandibular second premolar, there are two cusps. Crown is narrow lingually, whereas in second premolar, crown is wider lingually. In mandibular first premolar, lingual cusp is very short and non-functional, whereas mandibular second premolar mein lingual cusp is pronounced. There is a mesolingual groove, which is a characteristic feature of mandibular first premolar, which is not seen in mandibular second premolar. However, there is a lingual groove between the two lingual cusps in a three cusp variety. The mesial marginal ridge is lower than distal in cases of first premolar, whereas the distal marginal ridge is lower than the mesial in cases of second premolar. Also, we can compare them from the proximal views because the mesial marginal ridge is lower and parallel to the buccal triangular ridge, whereas the mesial marginal ridge is higher in cases of second premolar. The lingual cusp is very short, whereas in cases of second premolar, it is not that small in comparison to the first premolars. And mesolingual grooves is seen in the mandibular first premolar, and in the mandibular second premolar, we can see two lingual cusps which are visible from distal. So we can appreciate these differences with the help of these diagrams. In mandibular right first premolar, the marginal ridges are lower and they are parallel to the buccal triangular ridge. There is a severe crown tilt and the lingual cusp is very small. Whereas when you compare it with the second premolar, the lingual cusp is smaller, but it is not that short to that of the first premolar, and the marginal ridges are higher. Okay. Also, there are differences in the occlusal anatomy. When you see the occlusal anatomy of mandibular right first premolar, the outline is diamond shape. The occlusal table is smaller and it is occlusally converging towards the lingual surface, and there is a mesial mesolingual groove which can be appreciated. When you see the mandibular second premolar, there are two varieties, two cusp variety and three cusp variety. Accordingly, you can see square or rounded anatomy. The occlusal table is wider in comparison to the first premolar, and you can appreciate Y shape and H shape grooves in cases of three cusp and two cusp varieties. This is the summary of the occlusal aspect, where you can appreciate the buccal ridge prominence, the crest of curvature. Also, you can appreciate two cusps, the buccal and the lingual cusp. The triangular ridges, that is the buccal triangular ridge and the distal triangular ridge, forming a transverse ridge. Then there are the marginal ridges on both the sides, the mesial marginal ridge and the distal marginal ridge, which bounds two fossae, the mesial triangular fossa and the distal triangular fossa. Also, there is a characteristic feature, that is the mesolingual groove, which can be appreciated in the occlusal anatomy, which is a distinguishing feature for mandibular first premolar. This is the summary of all the aspects. Thank you.